Hi there, I'm here. I want to welcome Angela Smith. She is the Business Development Officer at Healthcare Resources. It is a Medicare home health agency. We are talking about Medicare today. Healthcare Resources has an outstanding reputation in the DFW area. Cindy Copeland is an RN. She is the owner and founder of Healthcare Resources. They've been in business for 13 years, and they have a 99% patient satisfaction rate. We have worked together and coordinated care in the past, and I'm honored to have you all as our guest today. And we're going to talk about Medicare home health. A lot of people do not understand what Medicare provides in the home and what it doesn't provide. So the first thing is, we talked about you have to be homebound. Define what homebound means.
Homebound means that it's taxing to get out of your house. It takes effort to get out of your house. It doesn't mean that you can't get out of your house. You can still go to church, to get your hair done, to the grocery store. You can't go to the casino every night, but you have to, it has to be an effort for you to get out of your home.
Okay, good. And, we talked a little before. My stepfather had colon surgery, and he had a home health nurse coming out 3 times a week, and he was never home because he liked to go to the casino, and he couldn't stand to sit. He'd rather, instead of sitting at home waiting on the nurse, he'd rather be sitting at the casino at the craps table. So anyway, it was pretty funny. So they wound up having to cancel care because he was never home.
Send him to outpatient.
Yeah. Mm-hmm. So anyway, we're going to start with what is required to qualify for Medicare home health?
Well, first of all, you have to be homebound. You have to have a skilled need in your home, and you have to have doctor's orders.
Okay. So give me an example. I know a lot of times people are in the hospital and they get discharged with home health, or they're in a rehab facility for 21 days, and then they go home with abbreviated home health as they recover. But what about that healthy guy who's 75, fell, hurt his knee while at the gym, doesn't like to go see the doctor, but knows some physical therapy would do him some good? What are the steps that he would need to take to be able to get physical therapy in place?
Well, if he probably should go to the hospital to get his knee checked out, but he has to see his doctor. He has to have a doctor visit in order to get home health.
Okay, so what if he hasn't seen his doctor in a year? What would you recommend? Say his wife calls and says, hey, Angela, my husband can hardly walk. They don't feel anything's broken. He went to maybe a doc in the box emergency fast clinic. They said nothing's broken, but he is having trouble getting around, and I'm concerned. He's been home for 4 days. He's not really getting out of the chair. I really think you need some home health. What are the steps that I need to do? How can I get some physical therapy out here?
She could ask the doctor that they saw if they went to the doc in the box to write an order. Probably after they've left, it's going to be hard to get that. But he would definitely need to make an appointment with his primary doctor, and the doctor will, evaluate him and then send us an order for nursing physical therapy.
Okay. And, I know that the doctor has to certify that you need skilled nursing or physical therapy, speech therapy, occupational therapy. A lot of people think that, with Acappella, we are private duty. Right. We're private pay. I never want to duplicate services. So if I have a homebound patient that needs our care but really needs Medicare, I'm going to recommend a Medicare agency, because we've used our tax dollars. These people have paid their tax dollars to get those Medicare benefits, and they deserve those Medicare benefits, and they shouldn't have to pay out of pocket for those. But there are those patients that don't qualify for home health. and they need private duty and private pay. So there's a difference. We might be there to help with custodial care, like helping them with their bath or shower, or doing light housekeeping and, laundry and getting them to the doctor. So where you're different, it's more of the skilled services. Now, sometimes I've seen Medicare agencies that will provide a bath visit a couple times a week. So explain that, because some say that aid visit is not allowed. Some say it is. So give me an example of where a patient would qualify for a bath visit on Medicare Home Health.
I'll use my grandparents as an example. He's 99 almost, and she's almost 97, and they are on physical therapy. They didn't realize that they could get an aid to help them shower, and they really need it. So because they have physical therapy in the home, they qualify for that aid. And it's a couple times a week. It's not every day. A lot of people get that confused between what you do and what we do, but it's for bathing. They have to be showered. So.
And that's part of learning that physical therapy is learning how to safely get in the shower, how to safely, not fall, not slip. And that's the great thing with you guys too. You'll go into the home and assess the needs and assess if it is a safe environment.
Right.
And a lot of times it's not a safe environment. And you all will maybe work with private duty to help with things that need to be done to make the home safer.
Right.
Now, I know that you work with insurance companies, and we're not going to talk about that a little bit. We're talking about the 65-year-old patient and older that's Medicare. But there's some questions that I found online just when you're looking for a Medicare home health agency. With private duty, I have the philosophy that we are guests in their home. And they have a right. They have a right to choose who they want in their home. They have a right, if they think a nurse is rude or isn't proactive enough, they have the right to say, I don't like this agency, or I don't like this nurse, can I get somebody else? And that, I try to reiterate that with families, that you do have a choice. You are in the driver's seat. So tell me what you would do if you've got a patient and for whatever reason, he does not connect with your physical therapist. And he says, you know what, I just don't like him. He's rough with me, or he's being too bossy. And a lot of times patients just don't want to do the work. It's hard. It hurts. And that's why it's called therapy.
Nobody's really crazy about the physical therapist at first.
Right. So what do you do in that case? What do you, how can you keep that patient feeling that he's still in control and directing the ship?
Because I'm out in the field, I of course turn it over to our clinical director, but we'll get them a different PT, if that physical therapist, if that's what they need. If there's just, not everybody connects, not every personality connects. So if they, really are just adamant that they're not happy with their nurse or their physical therapist or their aide, then we work around that.
Okay. And say they're in the hospital and they get discharged with a home health agency. And I've seen this a lot with our private duty patients also. I say, has your Medicare nurse been out? Has your RN been out? No, we haven't heard from anybody. How long should they wait without a call? I mean, just standard. I know there are Medicare rules, but the rule of thumb, when you get a referral, how quickly do you notify the family to set up a time to meet?
We notify them as soon as we get the referral.
Okay, even if it's on the weekends?
Yes, we have weekend call nurses. You never get an answering service with us. We always have someone that answers the phone. You might have to leave a message and we call you right back, but we do have call nurses.
Well, and that's great. And I have found that some other Medicare agencies, they get a referral on Friday and the family doesn't hear from them for Monday or Tuesday, and that's not right. And I think they feel at a loss. They're so exhausted. They don't feel good. They're trying to figure out their meds. They're trying to figure out who's going to take care of grandpa, there's so much for them to have to absorb and figure out, and they get that discharge paperwork, and it's a maze. So that's good to know that they should hear from you by at least 24, 48 hours at the
Most
latest.
definitely.
Right.
Most
okay.
definitely.
And then what about, you've got a physical therapist that comes out, and I keep changing to physical therapist, or speaking of that, but does he have or she have a supervisor that pops in on her? Is there supervision for the staff?
We have our clinical director, yes, and then we have case managers.
Okay. When I did home health as a new nurse, I had supervisory visits a lot. So I was always, but I was a new nurse, so I was always prepared for that. And actually, I liked that, just having
Right.
somebody confirm that what I was doing was
Right.
was right. Okay. Now, not everybody just needs physical therapy. Say somebody has had a stroke and they need speech therapy. So do they have to have physical therapy, or can they just have one therapy?
They always have nursing, and usually I would say if they've had a stroke and they need speech therapy, they need physical therapy as well.
Okay. And then I know there's some specialized agencies. I know there's an agency that works a lot with respiratory therapy, and some that work with behavioral. Say somebody has addictions and needs home health, or is bipolar and needs some home health, with nurses that specialize in that disease process. What do you do if you can't provide the care? What if it's something that's really out of your realm? What would you recommend the family do?
Luckily, we have a wide variety of specialties because we have several nurses, so wound care, different specialties. But if it's something that we can't handle, then we will pass it to an agency that does specialize in that service.
And that, to me, is an ethical agency, because we've had people call us that we cannot provide the care that they're wanting. Just for whatever reason, we don't meet their needs. And I always will recommend another agency. And I feel like there is enough work, there's enough business for everybody. And if you provide the right business, you're going to continue to get business, and you can work with those people. And the main thing is just giving those seniors the care that they need.
Right.
Okay. Let's talk about an emergency. Everybody heard about the situation, Hurricane Harvey, where there were patients that were stranded. All that rain came in. And I know you're not a nurse and you're not on the clinical team, but how do you all address if there were an emergency?
We have a plan. We have an emergency disaster plan that's in place. I know as a marketer, I'm to call into the office or call into my supervisor and check to see what it is I need to do.
And we kind of do the same, because of Katrina and Harvey. The state of Texas is very strict on an emergency plan.
Yes.
So we don't want any of our patients, no matter what the weather or circumstance, to be hurt because we can't get to them. So we
Right.
work together and coordinate care to make sure. There's also a system called 211 and STEER. And so when we have a patient come on service, we automatically register them with STEER or 211. It's for people that are considered homebound.
Right.
And so the county does know those people that are homebound, and we work with them as well. If we see a concern, of course, we're gonna call authorities on that.
Right.
Okay, what do you do if you've got two neighbors? Okay, let's say they're in the same facility. One has a little wound and gets a visit once a week. One has a big wound and gets visits 4 times a week. The daughter of the wound that gets only once a week does not understand why her neighbor gets care 4 times a week. So how do you deal with that, determining what the care they're going to need and what Medicare will pay for?
That's done clinical, of course, which I'm not, but it's done with the initial evaluation with the RN case manager.
Okay.
And that does come up in some of the independent livings. How come you're seeing her so much and you're not seeing me? And I just go in and kind of run recon and make sure they understand, because her care is different from your care, and it usually works out.
So what would you, if you, and I think so much of your company and what you all do, you have a tremendous reputation, but if you were, you're on the receiving end, like say for your grandparents, they're getting care, what are some questions just the layperson should ask to know that they're going to get safe, qualified people in their home? What are some things that you would tell your grandparents to ask for, let's say?
I actually set up home care for my home health, and we don't cover that area, so I had to use another company. And I did ask, do you have RN case managers, a physical therapist in that area? Because they live in a rural area, is the physical therapist going to have to travel a long ways? Are they going to actually show up? Really getting to know the nurses. I think being active in your parents' or your grandparents' care is it's very important, because we can do the care that we do, but they need that home support as well. That's so important in a patient, getting better and getting back as independent as possible is the support that they have when we're not there. So that's, I know that my grandparents have that support, and my aunt was always there when the nurses came, always there when physical therapy comes, so that she can learn what they're doing and follow along when they're not there.
And that's what we do too with our private caregivers, is we make sure they're there when the physical therapy with the Medicare agency is there. And they're not physical therapists. Our caregivers are caregivers, but they can maybe do exercises that the family would be taught what to do, and make sure we've got that and coordinate that in the care plan. So we're working together.
Right.
So, and the goal is to nobody wants to be in the hospital. When somebody says, oh, send me to the hospital, they don't want to be there. It's horrible. The care, the doctors are there to treat the symptoms. But nobody wants to be in the hospital, and nobody wants to be in a rehab either, frankly. They want to be home. And so our goal is to get them home, get them healthy, get them back on their feet and back where they were independent, or as independent as possible. So this has been so great. Do you have anything else to add that you could say about what we all do? If you have a special example of someone that really succeeded with your company, their care?
We have lots of those, but I want to say, as far as what you do, caregiving, and what we do as a skilled need, a lot of people don't understand the difference. And I want them to understand that they can have us and they can have you, because we can work together. We can work together with the doctor, we can work together with the physical therapist, like you said, because that support system is so important to rehab back to as independent as possible. And we want them to age in place and stay in their home. So with the help of both of us together, I think that can be done.
And then if someone is not improving, and say your nurse sees, you know what, I really think this patient would benefit more from palliative care. Do you have that talk? Do you all have the talk with them? Does the doctor, how do y'all handle that if it is someone that's not showing signs of improvement?
Because I'm not clinical and I don't go see the patient in their home after they're on service, but I would think that our nurses would. But also, when we call in the hospice company, that's their specialty, not ours. So if we have to call in a hospice company, we would let them talk to the patient.
Okay. Yeah, that's good. That's good. This has been great. Thank you so much.
Thank you for having me.
And we're going to have some information. What is your phone number over there at your company?
It's 817-633-2273.
Okay, and tell me how many counties you all cover.
We covered Tarrant, some of Johnson, South Dallas, and we just opened up some of the Plano-McKinney area.
Okay, that's great. We're very excited. It was so nice to meet you. Thank you so much for
Thank you for having us.
Your help and answering questions. And if you have questions for Angela, please feel free to call. They're there to help and answer questions. And the goal is to be there for our seniors. Thank you.
Most definitely.
Thank you so much.